Thanks very much for your patience. So basically what I wanted to do is just speak very briefly about perhaps our experience with the training program here at Greenslopes, and then we'll move on to the JMOs having a quick discussion. So basically, if you haven't heard of us before, I'm a little bit surprised. We are the Australian largest private teaching hospital. We actually have over 24 years of experience in the private sector teaching. We've got extensive infrastructure here. We've been very well supported by the Commonwealth in the past. We have sim labs available. We have tutorial rooms, on-site library, conference facilities, which is one of the rooms that we're using right now. We have over 100 junior doctors currently that we employ, and at different times of the year we may actually be more than that. And we train staff from very first year, intern year, right to through to the final year of an advanced training. So we've actually been involved in training for a long, long time, very heavily involved with colleges, various colleges. We basically are accredited for obviously the PGY 1, 2 and 3 pre-vocational training. We basically are a level 3, the only level 3 private hospital that does basic physician training in Australia. And we actually have had that status for many years. And we do advanced training in surgery, medicine, emergency, intensive care, radiology, psychiatry. We've also actually very fortunate to have the University of Queensland Clinical School campus on site. And we also have a large Gallipoli Medical Research Foundation on site that does a lot of research around the gastro, I guess, respiratory, immunology, etc. So as far as this internship training program has been going, we've actually been involved since 2014. We were doing intern training prior to that, but in very small numbers. Since 2014, we have been routinely taking 30, 40 interns per year. We have as a result of that, we have very well established training networks across Queensland and the Northern Territory. And these are rural sites that we have been involved in really since day one. And I guess that's fortunate for us because, I'm sorry, all these people coming in, being admitted late, sort of causing a little bit of a fuss. Yeah, so I guess the beauty of this is that we've been involved in training for a long time. We're not new at it. We have well-established relationships with places across Queensland and in the Northern Territory for a number of years. So over the last 8 years, through this special Commonwealth funding program, we've now trained approximately 520 PGY 1s, 2s and 3s. And I guess to demonstrate our ability to deliver a successful program, the Commonwealth comes back to us every year. We actually are the largest intake for this program for the Commonwealth, and we have been since it started. Of those people who commenced their intern training with us, 97% have completed their internship training, and the 3% that haven't are ones that actually in the very early stages of this program around 2013-14 actually returned back to overseas to take up late offers that were provided to them there. Then about 65%, looking at the last few years, about 65% of those who have done their PGY 1 year with us actually stay on with us or actually stay on within our network that we introduce them to. So that's just a little bit about us. What I'd like to do now is actually just introduce you to Majid. Majid is actually a JHO with us now. He's from Sydney University, and he'll just give you a little bit of an overview from his perspective.
Perfect. Hello, everyone. My name is Majid. I did my med school at Sydney Uni and then applied for the private pathway. Got a few offers from Sydney, Perth, and Brisbane, Greenslopes, and finally chose Greenslopes, mostly because of the bigger center that it is, the level of training that it offers. Also, I'm interested in basic physician training. I've joined the college in my PGY 2 and I'm BPT 1 this year. And just the opportunities available for people interested in different specialties, and the fact that this is Greenslopes is part of the training network as one of the training networks in Brisbane. And it's been pretty good so far. Last year, I went to Darwin for 4.5 months for doing my Gen Surg and Gen Med rotations, which was a really good experience, combining that public and private experience in 1 year. And this year, I decided to stay at Greenslopes, I just got an Alice Springs rotation at the end of the year, which is what I was looking for in Gen Med, which would be a really valuable experience to be able to go there. The training at Greenslopes has been great as well. I'm mostly interested in medicine, so I've only done medical terms and an ED term here at Greenslopes. I can speak for those, and they have been pretty good, really good learning opportunities. You work directly with consultants, which some people might not like, but I believe that in a private hospital, you have direct access to some of the best consultants in the city who also work in public hospitals. And that could be a really good opportunity for everyone to build networks for later on, networks that others will have to go through so much hassle and emailing them multiple times, waiting for months to get a response from. And those bridges that you build will definitely be helpful, especially later on in training. And the environment, the learning environment and the support system has been pretty good. That's not to say at any hospital you might go to, you might have some people, and you can't make everyone happy. You can't keep everyone happy. People are going to complain. There are going to be issues in any hospital you go to. And Greenslopes does have its issues, but it all gets down to what you make out of it all. You can put in a lot of work. You can fill in the gaps that you feel exist there for your learning, and take advantage of everything that's available to you, and grow as you go further down the track. That's about it from, is there anything else you would like me to cover? Yeah, that's about it. I think others will have some more to add on to that.
Just so the next person I've got is Karthik. Karthik's actually a graduate from New England and he's a PGY1.
Hey guys, my name's Karthik. So I'm originally from Singapore and I graduated from the University of Newcastle last year. And just want to give you guys an idea of how the whole thought process went in terms of picking a hospital and things like that. So I guess for me, the first thing I wanted to kind of decide early on was I even going to apply to the junior doctor training program, right? It's a private hospital scheme, so you can apply into the private hospitals, or the alternative, though not impossible, was getting a hospital job in the New South Wales system. Statistically, getting a job in the government system is quite low. It will happen if you're willing to wait till December, January, jobs might show up. But it's a little bit of a waiting game. You don't really know what's going to show up. So for me, I leaned a bit towards the junior doctor training program. And then between that was about stratifying what your best options were in terms of hospitals. A little bit of Greenslopes itself. It's a common misconception that private hospitals tend to be smaller and not very well supported. And I guess in terms of Greenslopes, it's actually not very true because it's a 600 odd bed hospital, so it's pretty big. And they've got pretty much the exact same systems that all public hospitals do. So you have your consultants on most teams, on all teams, sorry, and registrars on most teams, and then JMOs like interns and residents on all other teams. So you still work in a general team concept. You're not just like running around like you would in peripheral hospitals, one person spread amongst many teams. There's a lot of support in terms of day-to-day activities. On top of that, with the accreditation due to the Greenslopes Hospital over the last few years, there's a very quite refined education program that runs through the week, which supplements the day-to-day activities that we do on the ward itself. The grand rounds also occurs here, and that's specifically to the Greenslopes hospitals and sent out to the peripheral sites as well. So that's one of the main things, I guess, to myth bust quite early on, because it is a really big hospital. There's a lot of quite a big patient load here. But yes, it's a private hospital, so the particular patient load you see here are a lot of veterans, a lot of older patients, It's not a trauma center, so you're not going to obviously get what you get in a tertiary trauma center. The rotations I've done so far, I've done all my 3 rotations here up till now at Greenslopes. So I started off in ED, went on to renal, and then I'm on Gen Med. ED is a different exposure to what you see in the public system. It's not a trauma center, so you're not going to see, you know, people coming in with wounds or like, you know, accidents or things like that, but more of acute presentation of chronic illnesses. That seems to be the more common presentations here. The medical terms here, you get very direct link to the consultants themselves. Some teams don't have registrars, so you pretty much do, you're the main person that takes care of all the patients in the wards. You work with the consultants directly, which is something you don't really get, like what Majid mentioned before. It's pretty good in terms of meeting new consultants and getting direct feedback from them as well. What else? On top of that, in terms of the rotations that you get here through the year, you get up to 2 rotations rurally as well. And yes, there are some skills that you don't particularly get to practice while you're here in the private hospital, so you won't be doing that many hands-on procedures like lumbar punctures or things like interventional things. But you definitely get your hand at doing those when you go to the peripheral sites, particularly Alice Springs and Kingaroy. Like, there's quite a few. I think it's about 5 rural sites every year. Everyone who's been to them has come back with raving reviews. So in terms of exposure to those kind of skills and pathologies, you definitely get that there. And all the rural sites are public hospitals as well. I think that's about it, really. And in terms of my experience here, it's been really good. I've had really good exposure to the consultants in terms of teaching. It's been really nice day to day. You get a lot of direct feedback on how to improve on your work, which is pretty good. And I mean, at first it was a bit, I guess it's a bit scary because you have to work with consultants who are pretty big dogs in their field, you know. Like most of them have other positions in other hospitals as well, so they've seen a lot of junior doctors. So it's something to get used to seeing the boss every day and being the direct person who talks to them every single day. But then it's a skill to learn, and it's been a great time here, so I highly recommend. All right. Thanks.
Hi, just the third person that we have asked us to have a bit of a quick chat is Ka Yi. And Ka Yi is from Wollongong, graduate, and has actually been to one of our remote sites, Thursday Island.
Hi everyone. So as you know, I'm from a graduate of Wollongong. So at that time, sometime around this time last year, I applied to Queensland Public, I applied to Victoria Public, and I also applied for New South Wales Public. And unfortunately, I was the only one waiting for an offer and didn't get any. So at that time, I was under a team, and the consultant asked me every day if I gotten a job offer yet, and the answer is always no. So I told him I'm considering to apply for the Greenslopes private hospital scheme, private hospital scheme. And then he asked me if I have any in mind. I said, I don't know, I haven't looked at the options yet. And he actually told me about Greenslopes, and I looked into it. I don't believe he's worked here before, but he seemed to know a lot about it, and he seemed to quite like the hospital system. So I looked it up, and it was around 600 bed hospital, I believe, and they seem to have a lot of specialties involved. So I was like, 600 beds is similar to the hospital I was at the time. So I'm like, yeah, if it's good enough for him, it's good enough for me, so I'll give it a go, and I applied. And it has been really, really good so far, definitely no regrets. So when I got all the term allocations, I got told that our first term I was placed in Thursday Island. So I had to Google where Thursday Island was, and it pinned all the way up there, and I was like, that's not right, so I'll Google it again. And then it pinned up there again, and I'm like, that's not right, that's not Australia, and it turns out it is still Australia. And 2 days of orientation here in Greenslopes, and up I went to Thursday Island. And first term, I'll be honest, I was really scared, knowing that I'll be going into a different state and public hospital. And I was told I was the only intern in the hospital for the ward. And I was very scared at first, but when I arrived, I felt I was very well supported. There was always some doctor that you have a consultant always with you. And I always felt I was supported. And I thought I would be isolated, but I didn't feel isolated. Everyone was really nice. All the bosses, consultants, allied health socialize with you, and the doctors there do a very good job at taking care of their own. So I had a really good time, and I would go back there in a heartbeat. When I was in Thursday Island, so it was busy, but there were some times where I was not busy. And one of the bosses at that time I was with asked me if I want to do some anesthetics, because he did some anesthetics. He's a rural generalist, all of them are up there. And I got to scrub in a couple times, watch some surgeries, do some anesthetics with him, which was great. And then I went on leave and came back here to Greenslopes. So I did a rehab term, and currently I'm on a gen med term. And I'm actually quite surprised, because I thought being in a private hospital you wouldn't be that busy, but I am quite busy. So currently I'm on a gen med team with 2 bosses, and I do see the bosses, at least one of them, every day. I do have a resident and I do have a registrar, so I do feel well supported. But even as an intern, I do feel I see my bosses all the time. I have to contact them at times, and they're very approachable. And I have 2 bosses, and I average about 20 to 30 patients a day. So that just gives you an idea of how busy it might be compared to where you are. And in Greenslopes, I think a lot of people are a bit skeptical, I guess. We are more supervised, but that's not necessarily a bad thing. I actually think you get a lot of teaching with consultants compared to not being with a consultant. And also you don't do as many procedures as you do here, but I got to do a lot of it when I was in my rural rotation, and I have another rural rotation at the end of the year for ED. So I think it's actually a really good mix going in, and even though you're in a private hospital, but you get to rotate out of the private hospital into public systems. So you get the best of both worlds, in my opinion. And that's all I have to add.
See ya. So that was just some of the pictures of interns that were with us in 2019, and that's Majid at the back, who's now the JHO that spoke to you. So, look, we believe that the training that we offer here is of high quality. We think that what we provide is quite unique. Basically, the private sector is a key part of the Australian healthcare system. The Australian healthcare system could not work without it. And basically, in the private healthcare system, 40% of all patients or medical patients are admitted in our healthcare system, and we perform over close to 60% of all the acute surgery. So I think it's really important, if you've come from a part of the state or part of Australia where you see small little private healthcare hospitals, that you do understand very clearly that Greenslopes is not that. It's a large tertiary site, and we are definitely right up there with acute medicine. We believe that part of the quality of our training program is that we're giving you exposure to the public hospitals. These are in the rural remote medicine or remote areas, but you're also getting that private sector. So that getting that balance, we believe, is really important. And that's one of the reasons that the Commonwealth has provided the funding to us for interns. and over the last 10 years has been providing funding to us for advanced trainees to come here. They realised that there was no point producing new doctors who only understood one half of the healthcare system of Australia. The rotations that we provide are high quality. As we said before, we rotate people to sites we've been rotating to for a long time. The feedback is consistently good. As Majid said, you'll always find sites where at different times there could be some issues. Those things are very easily resolved. But in general, all our doctors are happy with where they go. And that's why we have maintained those relationships that we do have. And those relationships are for intern rotations as well as JHOs. So we have at any one time 5 or 6 residents off site, and we have up to 13 interns off site every rotation. As the doctors have just said, supervisors here, the daily face-to-face supervision is, I think, a unique aspect of what we offer. That is something that you would not get in the public sector. It provides lots of opportunities for informal teaching, discussion about cases that you're seeing, and it provides lots of opportunities for that informal feedback, which is also a key component of you improving and learning. I guess another aspect to realise too is, I know when the number of interns in Australia had to be increased because we needed more doctors, there was a lot of intern rotations that were created in the public sector to get the numbers through, and there was a real concern that actually junior doctors were having a sort of potentially a bit of a watered down experience because of that. That's definitely not the case here. Look, we have the ability to allocate interns to intensive care if we wanted to, radiology and those sorts of places. We haven't done that. We've actually got them in places where they're hands-on, having quality experience with supervisors every day. And it's definitely not a watered down approach. If anything, it's the opposite. And that's why we have a lot of BPTs that come here and want to come here to do their exams. During our last accreditation for internship training here, this was, we had a commendation specifically about our VMOs and our medical education unit. And three of the key aspects that they mentioned in that commendation was the provision of well-rounded and engaging terms, the strong focus on provision of rich learning opportunities, and the vitality amongst the teaching community across Greenslopes. It's quite unique. We're a private hospital. We have up to 34 interns. We have up to 100 JMOs, and we don't pay any of our VMOs to provide supervision to you. They provide supervision because they want to work with JMOs. So it's quite a different concept to what you find in the public sector. I guess the other thing I just want to point out as well is that the Australian Medical Council currently are undertaking a major review of the National Framework for Internship Standards. And one aspect of all the bits that they're looking at is they're actually considering the training environment and basically what needs to perhaps change in the training environment to ensure that the medical education that we're providing you in your internship is really meeting the community needs. And one of those aspects is that they're looking at actually expanding the settings. So they're looking at perhaps people going to not one site for their internship, but perhaps going to 1 or 2 sites and different types of sites to broaden that experience. And in actual fact, that's what we're doing here right now. You're getting the experience in the private sector, the public sector, a metropolitan city hospital, a remote or a regional site. This is just to give you a few pictures of some of the photos that different trainees sometimes provide me. This first one's from Alice Springs. This actually was a resident, and she was really into triathlons. So she took her bike out for her 12-week rotation. She joined the Triathlon Association there, and she was out and about probably every morning before she went to work, no doubt. But there are just a few of the pictures that she shared with me. Got engaged, had a fantastic time. This is just 2 pictures from Kingaroy. Kingaroy is about 3 hours northwest of here. Lovely little rural regional town. It actually has the highest number of birth rates in a regional town in Queensland, so you can imagine it'll be very busy. Known for its peanuts and beef production, etc. So really lovely, and wine. And this is Thursday Island, where Kayi spoke about her first rotation. So this is actually the hospital right here on the Cape of the island. Everything about their healthcare system is associated with the water because that's what the Torres Strait people are so connected with. And so even there's renal dialysis unit that's actually right there, faces over the water, which is just really beautiful. And that's just a look out from behind the actual site. These sites, and we've all visited, we go there regularly to check in on how things are going, and obviously we have a effective working relationship with these people. So a little bit about what we do. So now a little bit more about the recruitment process, which I guess is some of the things that you guys might be equally as interested in. I guess the most important thing is that I always say the ownership of understanding what's going on lays with you. You really need to make sure that you're watching the website for the private hospital stream program and you understand what the requirements are. Normally, information is up there now, and normally they open up for expressions of interest around the September timeframe. Details are then forwarded to us, and that normally doesn't come to us till almost the second week of October. And it's not till then that we can actually start to look at who has shown an expression of interest for this particular program in Australia, who's potentially shown interest in Greenslopes specifically or Queensland, and we start to actually go through the process of working out what we might want to do. They deliberately don't give us the names until late, and the whole idea is they're trying to time that with the offer rounds that go across all the states. The whole idea is that they want to give you your first, give you the chance of getting into the public healthcare system, and they don't want us to spend lots and lots of time at the recruitment process, and then at the last minute you're offered a position with the state, and we've wasted a lot of time and energy, and yeah, they want to make sure that the whole process is done fairly efficiently. So you need to make sure what priority group do you actually belong to. And that's really important. The criteria is clearly written on their website. We as an organisation have an agreement that we sign with them, and we have to follow the processes. And the process is really clear. We're able to only select from priority ones until all priority ones are chosen. And every year it's really hard to know, will we expand to the priority twos? Last year, there was a lot of priority ones, and you know, Greenslopes and Brisbane was definitely the focus for a number of people. I didn't think we'd go to the priority twos at all. But you know, by November timeframe, several late offers were coming through, and it did just take us a little while to finish those last few numbers of recruitment. We actually pick up 34, so we're the largest hospital involved in this whole program, and we also have a Ramsay site in Perth that does recruit as well, and I'm not quite sure of their numbers. I think it's the early 20s. So Ramsay definitely is a big part of this whole process. So to be priority one, you need to be the international fee-paying student who completes their whole training in Australia. You need to complete your training this year. So if for whatever reason you've got a delayed assessment or you have to repeat something and you're actually graduating in next year, you definitely fall into the priority two. That's just what the rules are. The other thing that they also say to meet the criteria to be an applicant, you actually have had to have already done your English test prior to the application. So again, you need to take responsibility, look at the APRA site and understand whether or not you are a graduate that may need to do the English test in order for yourself to be gain general registration. That's really important. I did pick up one person who didn't have it done, and it was a little bit grey that point last year. And that person did actually create a lot of headaches for me in the actual starting. Everything was delayed. They were supposed to be starting in January, and they really ended up starting in about February by the time they did all these particular tests. Tests got sent from different areas and got into APRA that was now already backlogged with other applicants. So please, the criteria says that, and this year I will be making sure that the English tests are done because it just causes such run-on effects for us over the Christmas period trying to sort these things out. The other thing that you provide is basically just basic details about who you are, what university, date of birth, where you come from, and basically you confirm that you do meet the priority one criteria, some contact details, And that's basically it. The most important thing I would have to say is make sure you're giving contact details that are going to be details that are workable in case that you do happen to get the chance to leave Australia for a short period of time. And just be aware that it would probably be around late October, November, hospitals will be trying to contact you to understand whether or not you meet their needs and they meet yours. On the actual expression of interest that you provide, you will also actually have the option of making a comment about if you have any career aspirations that you want to comment about. That's optional, it's up to you. It doesn't have a big impact on whether or not I would pick you up or not, but it doesn't hurt. I do often look at it because it gives me something to perhaps talk to you about when I actually first ring you. And the other thing is do you have a preference for location? In the past, they actually haven't provided a list of the locations. I think they might be now, but basically what they do require, again, it's optional, but what we use as a means of trying to work out where do we start with this whole recruitment process, that is the first thing that I would go to. I'd actually would look to see, has this person mentioned Greenslopes Private Hospital? Have they mentioned Southeast Queensland? Have they mentioned Queensland? And I guess the reason I do that is that it shows that there's some sort of connectivity with us or with the state. And I guess the reason why that's important is that if you've only listed Victoria or you've listed a few other places that you're really keen to go to, I do find that if I actually spent time talking to you, I'd probably find it difficult to really recruit you because your heart is somewhere else, and really I'd probably be wasting your time and my time. So from my perspective, the preference of where you might like to work is a bit of a pivotal point for where I actually start. I may branch out from that definitely, and I might look at where people say anywhere, etc. But that is a way for me to actually start going through potentially hundreds of applicants. The last thing I just would say, a tip from a point of view of references, I really would prefer to have VMOs only. Occasionally some people will give us clinical tutors. That's okay. Some people will give us registrars. I just feel, and so does our director, that basically having references from people who particularly have worked with you in the last 12 months, year 3, year 4, in the clinical setting, they're the people who are going to give us a really good understanding of how you're sort of assimilating into the health, the unit, and how you sort of maybe communicate, maybe your knowledge base, time management, etc. So from my perspective, references being VMO are really, really valuable. And obviously it's valuable to have people who work closely with you. Obviously, if you're being in a unit where you've had very little involvement with a particular VMO, but you might think that that particular person's known well and could look good in your CV, you'll often find that they can't really say much. It's usually a fairly bland type of reference because they don't know you. They haven't actually spent the time working with you. That's just my perspective. So what we would do then is that we would actually use your CV. We would actually send you a link, and it would be to our HR portal. You would upload a few basic details, some information about passports, etc., but you'd also upload your CV. We would also ask, have you applied to the Queensland RMO campaign, to the Queensland Internship Program? And if you have, that means that we could actually access references for you straight away off that system rather than chasing people for paperwork. We would then use your CV and those references as a means of scoring you to come up with a number. And that number then we would use, obviously the highest scores we would start with, and then we would work through having phone interviews and discussions about jobs and sort of work through that way. So that's basically how we sort of run that from here. As you can imagine, a lot of the states already have people's names and they're already starting to do their recruitment paperwork for interns. We're not actually starting till late October, early November. It's a really, really tight time frame for us, and it's leading into the Christmas holidays where APRA closes and we're trying to sort visas. So efficiencies across all this process is really important for us. And we will ask you to chase some references for us. we might ask a second time and we don't do anything more after that. We'll move on to the next person, just because of the sheer time that this actually can take us to progress through. Hence the value of getting the references of the state application process. So what I'd say also is be prepared. Obviously, you're a well-organised people. You've done lots of study, probably even before you've actually done your medical degree, and you're good at tasking, time management, and getting lots of tasks done. But just stay on top of a few key things, and I guess that is the English-speaking test that I've just referred to, if you're requiring it for the APRA registration, and just looking at what else you may need for the APRA registration. So often people will make some errors of getting the wrong police checks, etc. So print off what is required, underline what is required, and get some of the processes going as early as possible. APRA normally allow you to submit paperwork about 6 weeks, I think, prior to you graduating. The other thing is also look at visas. Definitely our preference is the visa 485. If we were going to pick you up, we will give you information about the process as well. But again, why not, if you've got downtime after an exam, why don't you read up about the visa 485 and just see maybe what sort of documentation you may require to support the processing of that as we progress forward. Once we've made an offer to you and you've confirmed that offer, we'll actually tell the Commonwealth so they actually know that you're no longer available for other sites to look at. And again, that's just trying to make it efficient for everyone. One of the questions that came through prior to this session was about the contracts. So look, we offer 1 or 2 year option of a contract. It's up to you. You can take what you want. If you're deciding to do a 1 year, that's not a negative thing. We don't mind. It makes no difference whether or not we offer you a job. Initially, we only ever offered 1 year contracts, and that was because the funding was conditional only for a year at a time. Now that we've secured funding for 3 years for this program, we know what we're doing. We're very happy to offer the 2 year. And just from experience of having relatives that are in the system as well, and talking to staff here, I know that often you're in term 2, April, May, and you're starting to have to make decisions about the next year. You could be in Thursday Island during that time, you could be Alice Springs, you could be at Greenslopes. So it's just a really difficult decision making sometimes when you perhaps just moved from another state and all you really want to do is settle a little bit. And that's why we've offered the 2 years. Majib's an example. So he's come, he decided he was moving from Sydney to Brisbane, and he committed to 2 years so he could just sort of settle and reassess, what he was doing, where he's going, and he's now settled. He's doing his BPT training now in Brisbane. The employment entitlements would be exactly the same as if it was in Queensland Health. So you're not disadvantaged pay-wise or penalty rate-wise, etc. What we would do is if we've offered you a position, we would then send you a SurveyMonkey link, and we'd actually give you a few basic details about preferences and leave. We give all the leave in 5-week blocks because it's far easier to manage from our end, but more importantly, it's far better for the teams and the sites that you go to. When we promise external rural regional sites rotations, we are determined to fill those, and sometimes if things go pear-shaped, we will run short here at Greenslopes in preference to letting those small sites who are so dependent on your staffing to go short. So when you're in teams, I know our teams here, they can be big, and the last thing they want is to have registrars doing exams coming and going, residents coming and going at different times, and interns. So this way, by doing people's leave allocations in 5-week blocks, it really gives continuity to the teams, and I think allows people to build their confidence prior to moving on, rather than doing 2 weeks and a few weeks away. If people have a need to have some time off, for example, in the past, sometimes people want to go back to Adelaide because they've got their graduation. It's about talking to us early, letting us know about that. We might try not to have you in Thursday Island, so it's a little bit easier to commute. And what we would probably try and do is maybe change your roster a little bit, so maybe you can have the Friday and the Monday off and work around it. All the time, what we're thinking about though is to make sure that we offer you the best that we can in the learning opportunities, be fair to everyone, and meet the requirements of what we need to do to sign off your internship. So you have to work 47 weeks, and there are certain core terms that you have to do of certain lengths. So that's all in the decision making of how we actually do our allocations. We'll ask you, have you got a preference for a site to go to? And maybe you might want to go to a site because you've got a friend going there, or you think, you know, places like Alice Springs or Thursday Island look a bit exotic. We can rotate you for there. Or you may have a particular interest in a particular, you know, like a renal disease or pediatrics or something, and we'll try and align allocations around that as well. Also, some people will have leave. We find most people want leave towards the end of the year, which, as you can imagine, is not doable because we actually have to have roles filled across the year. So we will ask you, we'll give you all the dates, and we'll ask you to preference what leave you would like, and is there a reason why you really need to have that particular preference, and if so, why? And then we'll try and give you that leave as much as we can, but as I said, we can only have certain groups of people, numbers away. People will sometimes have leave in the very first term if there's some potential visa delays. So we know straight away if people aren't going to have a 485, which usually will allow you to start work because your 485 current visa will go through till about March. If you can't have a 485 or for whatever reason it just doesn't work, we will often allocate leave to you up front. So you basically, we have 5 more weeks to get visas sorted, which again can be very slow over the Christmas period. So the idea is to have this all sorted and you all sorted and ready to start at orientation week, which is the 11th of January next year. And you would either come direct to us and have a whole week of orientation here. If you're at a small site like Thursday Island or close near here, you might come and have a few days with us and then have a travel day and then have a few days working with the intern that's leaving that site. Or we send you direct to Mackay or to Alice Springs for their whole week there to help you assimilate in and get a little bit more opportunity to orientate because they have electronic records there. So I've just mentioned a few sites, but basically we have been and we plan to at this stage for next year continue with the Gympie, Goondiwindi, which I've spelt wrong, Kingaroy, Mackay, Thursday Island, Alice Springs. We organise all the flights. We pay for those flights. We pay for your accommodation when you're here. When you're at those sites. So if you were going direct to Mackay, or Thursday Island, you haven't got to worry about accommodation for a period of time. It's all sorted and you organise your accommodation when you get back to Brisbane. While you're off-site, we actually maintain total responsibility for you and oversight of the intern training program. We'll be in touch with you usually a few weeks after you start to make sure things are settled in as we thought they would. And we provide some education opportunities whilst you're out there by Zoom. And we're in contact with them regards assessments and how you're going as well. Main thing to be aware of is sometimes people might want to drive the car to places like Mackay and places like that. You can drive your car, but we always want to make sure that there's sufficient time to drive back to Brisbane or your next rotation safely. So again, we'll have that bit of a governance and try and help you make the right decisions so things go according to plan. That just gives you an idea of what we're rotating to as of this year, pretty similar to the last year or two, and I would say pretty similar to what we will be offering next year. So you can see Green Slopes has got a fair bit of subspecialty there: geriatric rehab, respiratory, haematology, nephrology, oncology, infectious diseases, and then we've got about 5 or 6 surgical ones: gen surg, neurosurgery, orthopedics, plastics, urology. And then obviously most sites that you rotate to off-site have emergency, some of them will have medicine, some of them will have surgery, and then we also do an obstetrics at Gympie. And Thursday Island is just called rural health. So it's a bit of a mixture. It'll have a bit of medicine, it might have a little bit of surgery, and it might have a little bit of obstetrics as well, babies and kids. So I'm actually going to pass you across to Dr. Leanne Bennett, who is our Director of Medical Training, and she's going to talk a little bit more about Green Slopes and training from her perspective.
Good afternoon. I hope you're all still awake. We've been going for a little while now. I'm going to tell you a little bit about here at Greenslopes, and I'm going to tell you a bit about myself first. So I am an emergency medicine physician who works across 2 sites. I work privately here at Greenslopes, and I also work publicly at the Royal Brisbane and Women's Hospital, which for those of you who know Brisbane, the Royal Brisbane's on the north side of the river and Greenslopes is on the south side of the river. And it's a little bit of a north-south divide, but nevertheless, I kind of work across both sides. I've worked here at Greenslopes for probably about the last 10 years now in the emergency department. And in more recent times, I've taken on this new role here, which is the Director of Medical Training. I guess I have a background in medical administration and education, which is why I do this job, because I want to make sure that we really provide a great training ground here and great opportunities for junior doctors so that they can get a really great feel of what private medicine is, because I think most people in the future are going to work publicly and privately. And I think Greenslopes is a great place to work. So I'm going to tell you a bit more about Greenslopes first of all. So this is the front of the hospital. It is a fairly decent sized hospital actually for a private facility, and we have lots of junior doctors who come and work with us here. So this is what the front of the hospital looks like. So we're just over 600 beds. We are licensed for a few more than that, but obviously we don't necessarily keep all of those beds open all of the time. We have an emergency centre here, which, as I mentioned just before, I work in as well. We don't see a lot of trauma, as one of our previous speakers mentioned. Now, that said, we still see people who, you know, twist their ankles and get fracture dislocations, and people who fall and who have head injuries and intracranial bleeds. We just don't see the big motorbike and car accidents, which I see plenty of in my other job. So that's what the emergency centre here looks like. There's lots of specialties here and lots of specialty clinics, which you may get some time in. We have got a 16-bed ICU, which takes a really wide range of patients. So we do lots of cardiac surgery here. So we take a lot of post-op cardiac and post-op big abdominal surgeries here. We also obviously have the pneumonias and the urosepsis and all the array of other things. Obviously, again, as I mentioned before, not a lot of trauma in our ICU. We've got a really big coronary care unit here, and certainly lots of patients who maybe are seen publicly would get transferred here privately for their ongoing care of their cardiac conditions. And we have 3 cath labs, and certainly patients who have a myocardial infarction in the community or a heart attack may come here for their primary PCI, and we have a pre-hospital activation system that Queensland Ambulance Service actually run very nicely, and we would get people who would come for an acute percutaneous intervention. Lots and lots and lots of surgery. I think Claire mentioned in one of her previous slides that actually the public system, although it's very busy with different things, the private sector actually definitely services a lot of surgery, and our operating theatres are incredibly busy. We have lots of specialists who work publicly and privately, so you'll definitely find people who are very advanced in their surgical techniques and with lots of modern approaches. In recent times, we've developed a maternity unit here, and we do actually have a level 4 nursery as well. You guys don't really get particularly involved, I'll be honest, in terms of the maternities and the paediatrics and the neonates. That's not something that at the moment we send our junior doctors into, but obviously it's something that we provide here as a hospital. A big radiation oncology service here, lots of day oncology. We've got a fairly unique mental health unit here, which is called the Keith Payne unit. And what that unit is really for veterans, because Greenslopes was set up as a veterans hospital originally. So that's a fairly unique boutique mental health service. So it's not open to the general depression or bipolar. It's really specifically for veterans with PTSD and complex mental health problems. And we do have a junior doctor who helps up in there in the psychiatry area. We have a big rehab unit, as I think a couple of our speakers have mentioned. We do see lots of older people here, and after their acute medical stay is over, they obviously need some ongoing care and some ongoing rehab, and we have a really lovely rehab unit here on site, and lots of day therapy and day programs that run as well. So that's a little bit about our hospital. I guess the question, and maybe there's been some answers, but why would you think about coming here to Greenslopes? So we think that we do offer a really great, well-rounded experience for juniors. We think that the things that you get here are going to be very similar to what you would get in public land in most cases, but I guess the things that we feel we can offer a really great experience for are the very close supervision you get with very senior medical officers. So for those of you who've done lots of time in public hospitals, and I'm allowed to say this because I work in a public hospital as well, it's very busy and people are really stretched, and the supervision oftentimes is from the registrars, and they might be off in clinics, so sometimes the supervision element isn't as great as it could be. So we think that the experience that you get here in terms of that really good close supervision by the specialists is actually an invaluable learning experience for you. It actually affords lots of opportunities, so you'll get to meet people not only from the specialty you working, so let's say you're on a general medical rotation, it might be that that patient gets an endocrinology consultation, an infectious disease consultation, a cardiology consultation, and obviously you have all those interactions with specialists in different areas as well. We like to think that you would feel well supported here. We hope so. That's one of the things that we really put a lot of time and energy into. We want to make sure that you get a really great intern experience and feel that our unit and our medical education unit is fairly small. It's composed of Claire and myself. There's a medical education coordinator and a couple of really lovely admin ladies that help us out and you out with all your placements. So we feel that we're pretty good at supporting the junior doctors. Not everybody has a great intern year, it has to be said. Now that might be personally or professionally, and we like to think that we're here and around and available if things aren't going so well. Even though this is quite a big hospital, so there's over 600 beds, it actually doesn't feel like that. It actually feels like a lot smaller a place. I think that's because people get to know each other quite well, and the people that work here are fairly static, obviously, particularly in terms of the consultant group. So even though it's a fairly big hospital, people get to know each other and actually very kind. Because of the private model, I think the thing I like about it probably most is, for those of you that's worked in emergency and you try and refer a patient onto somebody, sometimes you get a lot of pushback with that. The joy of the private system is people want to look after patients, obviously because that's financially how the private model works, but it means that you will often get somebody at the other end of the phone who actually really wants to help you and wants to help take care of your patient. And personally, I really like that because I think it's a really great model of patient care. You will see an array of patients here. So we have talked a lot about the older patients, and there's definitely no two ways about it. You are going to see lots of people who are older in years. Now, I like looking after older people. Some people may not, but what it does afford you is lots of medical problems that come with those older patients. The other thing about private patients is that people pay to come to this hospital. They're generally nice people, and they actually have oftentimes a very wide array of pathologies. So I think Karthik talked earlier on about busting some myths. Certainly, please don't think that the private hospital is full of not unwell patients. We see lots of complex patients here who are very unwell, and certainly not an emergency shift goes by where I don't see several very sick people who are also very interesting clinically. So that's a little bit about some of the experience factors here at Greenslopes. I think the rural time is really invaluable. It's something that we don't do in the UK, so I'll talk in a few minutes about my internship. So, but it certainly wasn't something I was exposed to. And then I came here to Australia and did some resident medical officer jobs and got seconded out to literally towns where I was the only doctor in town. And it was pretty scary at times, but it was also really worthwhile experience and made me stand on my own 2 feet. And I certainly feel it's a great opportunity that you get to go to some of these places. We really feel that we offer really good education here, and part of that is because of the setup of the private model with the VMOs. And we have lots of opportunities for education here. So we have the very formal education, which lots of places have. We consider that protected time. So the intern education and the JMO education is protected. So they're sessions that are aimed to be very individualized for those different doctor groups. Obviously, what you want to know as a VMO at Grand Rounds may be a bit different to what you as an intern just starting out work might want to know. Each of the different departments, and I can't list them all here because there's probably too many, but in each different department they have their own unit specific education. So within medicine, for example, there's the stroke unit meeting. In addition to that, the medical teams run every Monday a division of medicine education session. We do Grand Rounds, which is specific just for here at this hospital. And in those sessions, we really try and get a wide variety of speakers to come in and talk about all kinds of different things that will be interesting to the wider group. We pride ourselves on our ALS education, so it's something that I'm particularly interested in. I'm an ALS instructor for the Australian Resuscitation Council, and it's certainly something that I feel really passionately about here, that we equip you guys really well so that when you're on the wards with that unwell or deteriorating patient, that you can really step up and you really feel prepared for that. So those are all the really quite formal education opportunities here. And then in addition to that, and I don't really know why I put these second, because in some ways they may be even more valuable, are the more informal education opportunities. So particularly when you're on a ward round with a VMO, like one of our previous speakers said, really the opportunities are there and it's what you make of them. So certainly that's a great opportunity to ask questions, clarify things, watch consultants who are communicating, you know, oftentimes very bad or sad information with patients. They're really invaluable learning experiences. And we try and do some small group things as well that are very targeted and specific, particularly to things that when you start doing ward call, for example, that you might find challenging. So that's a little bit in and around our education setup here. As we've said, the supervision is particularly good. Some people may find it intimidating. I think somebody else said that before, but everybody here is, most people that work here are actually genuinely lovely and actually want to do the right thing by their patients and by their teams. So we like to think that you get a lot of value from that. We're very fortunate we have some quite specific education opportunities here on site. So the picture that you can see at the top of the screen there, and it's not a great picture, I'm afraid. The sign here, you can just about see it, is what we call the Francis Baron Burnett Centre. Some people here refer to it as a sim lab. And that's a really great purpose-built centre which lots of the medical students do their education in. They do mock wards and they do lots of procedural stuff. And the picture just down from that there shows one of the emergency doctors teaching a few of the junior doctors how to ventilate a patient, and then they'll do some sims and some scenarios. So we're very fortunate that we've got that purpose-built centre which you guys can have access to, and that's certainly something that we're doing more and more of, new education opportunities up there. I'm going to tell you finally, just to put things in perspective, I was an intern once, and although in some ways it feels like an eternity ago, in some ways it doesn't either. So I did my training back in the United Kingdom, so I'm from Manchester originally, and I did my medical degree in Manchester, and I've circled which bit of the country that's from. And I did my medical student training at a very big teaching hospital. It was very busy. I learned lots. And then I really decided that when I did my intern job, I wanted to go to somewhere that was a bit smaller. And this is the place I tried to find a sunny picture of this particular place, but obviously I'm from the UK and the north of England, and the black clouds go with the territory. So this is where I did my intern year, which was a place called Chorley in Lancashire. And it was, this was a cottage hospital, and it only had 200 and odd beds. It's probably a bit more than that now. It was a lovely place to work, and I've got great memories of the people, the fellow interns that I worked alongside, and developed some lovely friendships there. The picture that I show below that, the reason I show it is I wanted to point out this gentleman here to you, and I'm hoping that you can see that. So this is a gentleman called Dr. Jeremy Ward, and my first ever job as an intern was a 6-month surgical rotation on an upper GI team. And probably a similar time to the day that I started as an intern, this particular guy had started as a consultant. And I remember him taking me to one side and telling me that the 2 most stressful days of your whole working career are your first day as an intern and your first day as a consultant. And I thought he was mad, because I thought, when you become a consultant, how can that possibly be scary? And I became a consultant maybe 5 years or so ago, and it is pretty scary. Now, I'm hoping that the guys that start here as interns, we give them a really great orientation, and we have a really nice hospital and great teams to work on. And I'm hopeful that you wouldn't find it scary, but you'd have a really great experience. So that's a little bit about me being an intern. And these are some pictures of our interns this year, and I think most of them are smiling, and that's day 1, and I think most of them are still smiling, so obviously we're doing something right. So that's all that I had to say. I think Claire's going to come back on in case there's any other issues or anything else we wanted to talk about.
So look, that's really the main concepts that we wanted to cover. We wanted to give you a feel for the site, a feel for the program that we offer, an understanding of some of the processes that are involved from your expression of interest time right through to whilst you're working here. There was a few questions that were put forward to me that Calvin's been collecting, and I'll just run through a few. I think I've gone through reasonable amounts, but I'll just go through little bits and pieces, if you don't mind, to make sure I'm ticking the boxes. Can you believe it? I'm still admitting someone. Relocation fees for rural rotations. I've covered that off. We've talked about that. We don't do relocation fees. So if you were living in Sydney or England, New England area, and you were coming to us, that cost is yours. But absolutely, any cost associated with you going on rural rotations, we cover those costs for you. Any interview tips for green slopes, and there was a few things around CVs. What are you looking for, etc. Look. There's no interview tips. Basically, we will do a formal, informal, whatever you would like to call it, interview via phone. We will try and give you 24 hours notice of that interview. It'll probably be myself and or Leanne Bennett, who you've just met, or our Director of Clinical Training. It's not a complex interview. It's really just covering off some key things. For example, why are you potentially interested in green slopes? What are you interested in doing from a training perspective, so we can see how we potentially match. We few other bits and pieces, and we'll usually ask one clinical scenario. A fair bit of the process to get to that point is really around your references and your CV. And we use that information, as I said to you before, to get a sort of a score, which we will then work from through the prioritising of who to speak to. Someone's asked, will there be any changes to referee requirements due to COVID-19? No, because it's all done on basically online. Are the contracts binding? Is there a financial penalty if you were going to take a 2-year contract and you pull out earlier? Look, contracts are binding from the point of view that you agreed on something. Our expectation as a professional is that that is what you would do. I also do understand that sometimes things in life change, and we just have to be adaptable with that. I would expect, though, that you weren't going to do the 2-year contract with me, you'd be telling me well ahead of time and not be actively involved in the allocations of the 2nd year and at the last minute pull out. That would be unprofessional. Yeah, someone's actually asked in your second year, are you only based in Greenslopes? And I thought that was a good question to ask. So just want to cover off, we employ anywhere from 25 to 28 PGY 2s and 3s. As I said to you earlier, they're often people who have stayed on from the previous years, which is lovely. And you would normally do one rotation rule. And that's for two reasons. One is that the whole Commonwealth funding program for interns and for residents that we do get some funding for is about us providing some rural support, some rural connection. And really the idea is about if we provide that connection and that exposure, you might be interested in actually rural generalist or working in regional areas, which is a really good thing from a workforce perspective. So normally you basically are allocated to one. Occasionally I'll have people who want two because of the types of careers that they're thinking about, and that can be usually accommodated as well. And those discussions we'd be having right now for that next year. BBT training at Greenslopes, we've already spoken to you about that. We're actually a part of the Southside Training Network, which involves the Princess Alexandra Hospital. We're very close to the city itself, and we're very close to those metropolitan hospitals. So we have Princess Alexandra Hospital, a stone's throw away, QE2, Ipswich, Toowoomba, a little bit more regional, Logan, and there's one or two small sites up around Harvey Bay that are a part of that Southside network. But also just so you're aware too, we have lots of advanced trainees that are coming and going here. We have very close working relationships with all Brisbane and PA. We have very close working relationships with the some of these supervisors that are very well connected to their colleges as well. So for example, last year, I'm not sure if it's still this year, but the president of the Neurosurgery Association of Australia is a neurosurgeon here at Greenslopes. What makes an attractive candidate, one that stands out for Greenslopes? Well, as I said to you, basically someone who's saying straight away they're interested in Greenslopes or Queensland or Southeast Queensland is that first reason why I would actually start to look at your name. But really the references that we use, which are the references that are used by the Queensland Health, has a number of questions around teamwork, engagement, etc. And that's something that we actually believe in very strongly here. We're a private hospital. We're small teams normally. We want to be effective as teams. We want to respect one another. We're wanting people to be engaged, not people who need to be led. So by looking at your CV and seeing how you've been connected to perhaps your university community, and then looking at your references and seeing how you're connecting there with your sites when you're actually at practice, helps give us those feelings as well. There's no particular preferred format for CVs. I would probably say though, just the shorter it is, probably the easier it is. We don't need extensive understanding of all the roles that you played in each rotation that you had, because it's usually the same. Fairly short and succinct does make it a little bit easier for us to actually just review and find what we need to find. And we would potentially do the interviews by Zoom. The interview session would probably take about 20 minutes, depending on just what other questions that you might have, etc. So I think I've answered most of the questions that were sent through to me about 3 o'clock. Thanks very, very much for your interest. It was lovely to see how many people were interested in tapping in today. I will be providing a few more of these sessions through some of the states, just to make sure that we get coverage. And one of the reasons I first did this last year really was because of Majid, who you met earlier, and one or two that came from University of Sydney. And when they came up to see me, as he said, they had a few potential offers, and they really were quite blown away with the size of us. I think that they had this mentality that we were a small site, and really, was this going to be a second grade internship? And they came up to visit me and met a few people, spoke to a few people on the day that they were here, and could see that there was a lot of depth in here. And yeah, they said to me, look, Claire, you really need to make sure you talk to people down south, because people down south aren't used to hospitals of this size, and hence the reason why I have reached out and make sure that I'm covering off all states. We actively do want to recruit from all sites, all states, I should say. We find that that just gives us a really broad group of people. Everyone's a bit new then. Everyone's keen to get involved and get to know one another, and you start to form new friendships and groups, just like you did when you first started your medical degree when you moved to Australia. So that's all. Thank you very much. Thanks, Calvin, for your support.
Sorry, Claire, can I quickly jump in for a bit? Can you hear me?
Yep.
Sorry, Claire. There's a few more questions that come up. Would you have like a few minutes to answer it? I can just read them out to you.
Yes,
make
sure.
it easier.
I can.
So just the first question. This for those of you. I think in the application you only like put in the names and the contact details of the referees. For those people who actually want to submit a reference letters as well, are they allowed to?
Look, to tell you the truth, I probably really wouldn't look at them. We find that the template that we use for the references, which is the exact template that's on the Queensland Health, it breaks down to, as I said to you, things around research, teamwork, communication, clinical skills. And for us to be able to score people and make a comparison, we've got to use the same template. So if they did give it to us in our portal, I would probably read it, I would say, but I wouldn't score it. Because the other information that I'm sort of looking at as well is normally in their CV anyway, things around maybe some research and what community groups they're being involved with, etc.
Yeah, and then the other question they ask is whether there's any mental health term available in residencies.
Is there any what?
Mental health term. I apologize for the noise. I'm in the airport right now. Mental health term.
Term?
Mental health, psychiatry term.
Yeah, not in your internship year at Greenslopes, no, and not offsite either. We do have we've got a 29-bed psychiatry unit here that's for veteran patients only. We have an advanced trainee there, and during your PGY 2 year, you would be able to have exposure to that.
Yep.
Karthik, who spoke earlier, is actually interested in psychiatry.
Oh, beautiful.
Yep.
And then just last, previously you mentioned about the English requirement for the JDTP applications. I believe there has been some minor changes, and I just want to quickly clarify here if that's okay. So we had a long discussion with the JDTP program, given the difficult circumstances from COVID and some difficulty for certain individuals to get proper English tests done prior to the application date. So there will be some flexibility, but it will be judged by individual cases, and they have to have a very strong stance, a very, very strong story proving they cannot see the English test prior to the examination date. So this minor flexibility regarding to this requirement this year.
Okay, I'm just not quite sure how that flows on though, because APRA will still require it, correct?
Yes, so they have, instead of before September, they'll have to December to see a test.
Right, okay. So I appreciate you letting me know that. And look, hey, I understand there's been lots of difficulties for people across Australia, but particularly for, medical students trying to get placements and things sorted. I've got a friend who's got a med student year 4 in New South Wales, so I do understand that. And there's lots of other pressures that you've got with family being away. So I get that. The key thing though would be to try to have targets to get some stuff